Oncotype DX is a test that has been shown to have prognostic implications to help determine recurrence risk. And it's also predictive of patients who will benefit from chemotherapy. So our study was done to look at patients who actually have high Oncotype scores, which are recurrence scores greater than 25, who would be recommended to receive chemotherapy, to see how the proportion of patients who decline chemotherapy and factors associated with that declination and impact on overall survival. So we found that 11% of patients overall decline chemotherapy despite physician recommendations. And certain factors that we found that were implicated in higher odds of declination were things like race, ethnicity. So African American patients had higher odds of declining chemotherapy than the white patients. We also found that patients that were on public insurance or had no insurance at all had higher odds of declining chemotherapy compared to patients who were on private insurance. Higher Oncotype scores were associated with lower odds of chemotherapy declination. And then other things like nodal stage, so higher nodal N1 disease was associated with lower odds of chemotherapy declination. We also found that chemotherapy declination was associated with poorer overall survival, 5-year overall survival. So patients who declined chemotherapy had an overall survival in 5 years of around 87%, which was lower than 92% in patients who did not decline chemotherapy.